I chose Ohio State for residency first and foremost for the people that are here. Just genuine, awesome residents and attendings that are here that I really connected with on my interview day. And when it comes to working in an emergency medicine residency, the thing that you can really rely on are the people around you. And so when I interviewed here, I looked at the people that was here and I said, these are people that I would want to work with.
I think in choosing a residency, a big thing that was important to me was I wanted all the options on the table post-residency.
My favorite thing is the spectrum of things that we see here, from low to high acuity. We have a lot of really sick patients that I think we get exposed to here that maybe you don't get to see at other places given the amount of resources we have here.
You have a vast, complex, and multitudinous patient population that has a huge diversity in medical complexity that really pushes you to think a whole lot more than your traditional kind of urgent care or low acuity type setting. When I finish my 3 years here, when I go out into the community or if I stay in an academic center, wherever I go and practice, I'll be able to say that I've seen almost everything. And that whatever patient comes through my doors and that I see, I'll be able to handle that patient because I saw them first at Ohio State.
The mentorship here is incredible. The faculty here really want to, number one, get to know the residents, want to know what is important to them, and then challenge them appropriately and kind of propel their career forward.
We have really strong physician, attending, and resident relationship here. I recently had a really tough case and they reached out to me afterwards. I had a couple attendees just say like, hey, I heard you had a tough case, wanted to check in on how you're doing. We also do have debriefing afterwards where if you have any questions or concerns, you can bring them up immediately. But I thought it was really special that they reached out to me like the next day just to see how I was doing so we can stay mentally strong, because these are sometimes tough cases to handle on your own.
My particular interest comes in disaster medicine, mass casualty response. And when I first interviewed here at Ohio State, they went out of their way to find specific faculty mentors to interview me on things that were specifically highlighted in my application, which is something that other programs just didn't do. The community extends much more than just the residents and the attendings. I mean, we have fantastic nurses here, we have fantastic respiratory therapists and X-ray techs, lab techs, and this is basically a giant community of people that are all working together to help with patient care.
I think the values of the program kind of drive everything that we do. Caring for each other, caring for the patients that we see, connecting with your mentors, your faculty that you work with, your peers, your residents, the med students that you work with, and then ultimately your patients. I think that's important and allows us to build community and gets you through bad days and good days. I think in emergency medicine we see a lot of things that not everybody sees on a daily basis, and so having the relationships and the community around you to get you through those things is really important.
At Ohio State, the residency program has some interesting initiatives that I didn't see at a lot of other places. So we have a program on the EM side where we got an endowment specifically dedicated to resident wellness, and they actually have a fund that residents have access to for both personal and professional development related specifically and only to wellness. They also allocate funds for us once a month to go do something that's not related to your academic development at all, but just something like axe throwing or team bonding events. So we have a lot of opportunities for both personal and professional development.
One of the other things that made me choose this program is we have a really strong didactics session every week. It's more of a flipped classroom, and when it comes to education, I wanted to be in charge and responsible for my education, so I really enjoyed that aspect of our didactics, given that they expect you to come prepared and kind of know what you're talking about, but then also be able to add and build off of that baseline knowledge that you were able to get yourself.
I think something that I love about Columbus and that was important to me being an emergency physician is my days off don't follow everybody else's schedule, and so being somewhere where there's enough going on that if my day off is a Tuesday and I want to go out with friends, there's opportunities to do that. There's a lot of great local music, places to eat and drink, so that's been really fun to just kind of explore.
Living in Columbus has been actually a lot easier than I thought. The environment in Columbus is such that the winters are pretty mild and the summers are pretty mild as well compared to the Arizona summers, so I get a chance to do things that I wouldn't get to do year round. So in the winters here I can dust off my snowboard and I can use my bike during the spring, fall, and the summer season here as well, just like I could at home. The other thing that I found pleasantly surprising was that Columbus is a college town just like the one I came from, so there's a lot of similarities there in terms of ease of living, cost of living, and commute times and things like that.
My favorite thing about working at Ohio State is that I genuinely love coming to work. This is the first time in my entire life that I love waking up and going to work. And whether that's one specific thing, that this particular hospital has awesome people that work here and incredibly interesting and complex medical patients, maybe that's part of it, but there's something about the community here and the feel here that just makes me genuinely happy to get up and go to work.